Good morning to you.
Good morning, Julia.
Good morning. Let's talk about what's been going on in Greater Manchester. Of course, Stockport, Bolton and Trafford have all come out of their local lockdown restrictions overnight, but more than 500,000 people still affected. But Bolton and Trafford councils still concerned that their infection rates are still too high. Was it the right time to bring some of these places out of restrictions?
No, certainly in the case of Trafford Council, Julia, we said to the government last week that we didn't believe the time was right to lift the restrictions. But unfortunately, they did it anyway and didn't listen. So we find ourselves this morning, I have to say, in a very confusing position. We have restrictions lifted overnight in boroughs with high numbers of cases, and then we have neighbouring boroughs next door with lower numbers still under restrictions. So these things were always hard to explain to the public. How on earth do we do that? Do we do that now? It's a bit of a mess. I'm afraid of the government's making, and not here to sort of just go over, who said what to who about all of that. What I do want from the government is an exit strategy from all of this, to get beyond this debate about restrictions versus no restrictions. We actually need to start focusing on what we really need to do to bring the numbers down. And what we're clear about from evidence in Oldham, Stockport, Rochdale, it is door-to-door testing and tracing teams that are the most effective interventions. So let's move from blanket restrictions to more targeted interventions. That's, we think, the right way to go now.
And have you had the same issue in the Greater Manchester area as we saw in Leicester, where it was, particular neighbourhoods, particular streets even, where this was an issue, where this needs to be tackled, perhaps, public health teams going in and explaining the need to restrictions? Because we've seen it again and again and again, and the same has happened in Glasgow, where Nicola Sturgeon has announced in the 800,000 Scots affected with a partial lockdown there. She had 135 of the 314 new infections in the past 2 days happening in Glasgow, and most of them, vast majority, and I'm sure the same in Manchester, happening because of infections being passed inside people's homes. It's not people going to the pub or going to work or going to school even. It's what's happening in people's homes. Is this about a public health education programme about explaining the needs for social distancing?
Yes, it's certainly partly that, Julia. And to be honest with you, homes are a big part of the spread of the virus, but pubs aren't immune at all. We are seeing spread via pubs, so it's a mix, to be honest, and it's a challenging job. The truth of the matter is the national test and trace system is not working for us. It really isn't. What we have found is that the door-to-door work by councils, yes, giving out the messaging, but actually doing doorstep testing, then doing the contact tracing of people testing positive in that face-to-face way is much more effective than this call centre operation that we've got. And then beyond that, it is about financial support for people to self-isolate. Now, it's good that the government have recognised this issue at last, and they've set up a pilot in 3 boroughs. We would say that's not enough, to be honest with you. £13 a day for people in 3 boroughs. We quickly need to ensure that people on low pay, people who are self-employed, can self-isolate if they're asked to do so. This is a major issue that keeps coming back to us from all of our teams. And we're asking the government to help us devise an exit strategy from the restrictions that is about, number 1, door-to-door teams, number 2, financial support to self-isolate.
Yeah, again, £13 a day being offered, and again, only for the lowest earners. Even there are many people who on average incomes who don't have the sort of money where they can, most people in this country don't have savings of any large amount, and certainly not after lockdown, people who haven't been able to work. The idea that you could survive without any money or on £30 a day, if you've got a mortgage and rent to pay, kids to feed, people have got outgoings which don't just disappear for the 2 weeks they're asked to quarantine. Have you had any feedback from the government at all? The likes of the health secretary has said, yeah, I couldn't live on £13 a day, but we haven't seen any movement on that.
Well, there was a little, to be fair to them. So they announced a small pilot last week in Pendle, Blackburn and Oldham. And in those places, people on the lowest incomes will get £13 a day, as you say. But, let's think about it. £13 a day. What I've said to them is, you just need to go to a scheme like jury service. It's a similar thing, isn't it? The government is asking you to do something that's in the public good. In that case, serve on a jury. In this case, stay at home, take some time out to stop spreading the virus in your workplace or in your community. So it's the same principle, just cover their wages for the time that they're being asked to do that. That's what we do with jury service, and it's what we should do with tackling COVID. So, I just hope the government gets on and does it. They have acknowledged the issue, but it's a bit of a kind of a minor nod in the direction of the issue. And what we need is quick action. What we think, Julia, is that the public are getting confused here with all these restrictions, and not are they under restriction or are they not? We just need to go back to more simpler targeted interventions now. The restrictions can work to kind of have an impact in turning the tide around, if you like, if cases are rising. But their impact diminishes the longer that they're in. And I think that's what we're experiencing in Greater Manchester.
Indeed. And I know we've only got you for a few more moments, but I want to ask you about schools returning. You, of course, many of your former hats, a former Shadow Education Secretary. Getting the schools back, we know, very important, but also getting workers back in the workplace. We know that Greater Manchester actually had a much greater success getting people travelling back into their workplaces than in places like London, where it's where I am, it's virtually a ghost town in central London. How important do you think it is to get people back in their workplaces and turn our city centres back into the thriving places they were just a few months ago?
I agree with the government on that. I think it's very important, and it falls to people like me to lead by example. So I'll be returning to the office for the first time in 5 months this week, Julia, working at home today, but later in the week I will be returning to the office for the first time, and I'm doing that to send a message hopefully to others to say, look, we all need to support our city centre because it's crucial to us. The vibrancy of Manchester city centre really, really matters, and of course supporting the businesses that work there. So I am sending that message. It's crucial that we help schools return safely as well this week, but it does all link to that test and trace system. That is our first line of defence against this virus, and currently there are gaps in that defence, and I just hope the government can can go with us on this. Put it under local control. I think it will work much better if test and trace is under local control, because we would operate it as door to door rather than a call centre operation. So, it's not about, as I say, we're all learning, aren't we? And it's a difficult situation we're all in. But I think this week is a crucial week. We need to build confidence amongst office workers, confidence amongst parents and students, and test and trace is currently not providing it, and it needs to urgently.
Andy Burnham, Mayor of Greater Manchester, thank you as always for joining us.